targeting APOC3 in the familial Chylomicronemia syndrome. Definition: FCS is a very rare hereditary condition in which individuals lack properly functioning lipoprotein lipase, an enzyme that clears triglycerides from plasma. The destruction of the enzyme activity leads to very high concentration of triglycerides, particularly kilomicrons, in the plasma. Now, here is a video.
Well, someone can have high triglycerides and have no other symptoms. In fact, that's why many people do fine for a while. But the symptoms are most commonly related to the pancreatitis. So severe mid-epigastric abdominal pain radiating to the back, and they can often present in childhood. So certainly children have this condition and often are not diagnosed with it. Skin findings can occur, so a particular type of skin called xanthomas, eruptive xanthomas that come out on the skin. Of course, the most distinguishing feature is, in fact, the high triglycerides, which, when they're high enough, can actually make the blood look a bit creamy in color. And that's sometimes the first time this is identified is when a child or an adult with this condition has blood drawn, and their blood is a bit pearly or creamy in color, is a tip-off that they have this condition. Before an individual with FCS has pancreatitis, this is basically a silent condition. People have high triglycerides but don't know they have high triglycerides, and in fact will not know unless they actually get them measured as part of a screening test. So this is often an underdiagnosed disorder, especially prior to the first episode of pancreatitis, because it's silent. It's not causing any symptoms, and someone would have to have a blood test and specifically have triglycerides measured in order to pick it up. So that's really the big tip-off, is that high triglycerides on screening. Of course, unfortunately, many people don't get diagnosed until they have their first episode of pancreatitis, which should definitely tip off the possibility of this condition. But of course, that first episode of pancreatitis can be very severe, and in some cases, regrettably, can be fatal.
Well, let's continue. APOC3. APOC3 is a relatively small protein containing 79 amino acids. APOC3 inhibits lipoprotein lipase and hepatic lipase. It is thought to inhibit hepatic uptake of triglyceride-rich particles. Symptoms. As the doctor in the video said, patients with this syndrome have plasma triglycerides levels ranging from 10 to 100 times to the normal value. Eruptive xanthomas, arthralgias, neurologic symptoms, lipemia, retinalis, and hepatosplenomegaly. Without pancreatitis, they interfere with normal life and result in frequent hospitalizations. Current treatment options, low-fat diets, do not properly reduce triglycerides, and patients with FCS are at increased risk of recurrent and potentially fatal pancreatitis and other complications. ISIS APOC3-RX is an antisense drug designed to reduce APOC3, which is known to regulate the LPL-dependent pathway. The study. The extremely small open-label study showed that all patients with FCS given ISIS APOC3-RX 300 micrograms over a 13-week period were able to lower their triglyceride levels. These data support the role of APOC3 as a key regulator of LPL-independent pathway of triglycerides metabolism. Now, this is a video about the study.
New research this morning finds a single gene may be critical to lowering your heart attack risk. Two medical studies identified a gene mutation that affects triglycerides, one of the main indicators of heart health. Our Dr. David Agus is in Los Angeles. Doctor, good morning.
Good morning, Charlie.
Tell us more about what these studies tell us.
Well, for the last 30 years, the way we've treated heart disease is by lowering LDL, which we had called the bad cholesterol. Now, two separate papers in the New England Journal of Medicine, two studies, show that triglycerides were just as important. And people who had a mutation in one gene called APOC3, well, this gene was meant to keep triglycerides up. And when it's mutated or turned off, triglycerides go down. And heart disease goes down pretty dramatically in these people. So we now have, for the first time, a new target to prevent or delay heart disease.
So to figure out how to duplicate this mutated gene, then they're a long way to preventing heart attacks?
No question about it. There's actually a drug now in development that hits this gene and turns it off, and it lowers triglycerides in patients. We've yet to see whether it prevents heart attacks, but there's certainly a lot of hope.
This is fascinating, Doctor, because we know that heart attacks are the leading killer in the United States. We currently have statins, which help, but there hasn't been a new drug for decades, right?
No question about it. 600,000 deaths a year. And, we now have something we could target. And it's really exciting how they came about. Historically in medicine, we throw out the outliers. The physics, they look at the outliers, and they made many of their great laws. Well, there was a group of Amish that had very low triglycerides and low heart disease. And in fact, when they would eat a milkshake, their triglycerides wouldn't go up. And it was originally shown in these people, this particular gene, and now we know the exact mechanism and we can target it.
All right. Thank you so much, Dr. David Agus.